I'm Anna Quaadgras. I am the director of the MIT Sloan Health Systems Initiative, which is where the healthcare certificate is housed. And I also co-teach one of the core courses in the certificate, Healthcare Lab, which is an action learning lab. But we'll get into all of that in a couple of minutes. So the healthcare certificate really focuses on the management issues in healthcare. And we really did see a lot of those issues during COVID. And these are just some news articles about, for example, running out of ICU beds, and analytics in healthcare. We have economics issues around healthcare, about rationing and about paying for healthcare. And we also have innovation issues that were highlighted by COVID-19, digital health startups, AI, and of course the medical startups and the entire COVID vaccine initiative. So COVID really has been a microcosm of all the issues that we look at here at Sloan in healthcare, and things that you will learn about in doing the healthcare certificate. Now, I want to reassure you, you do not need to have a background in healthcare to do well and to earn the healthcare certificate. In fact, we encourage people who might not have a background to really explore healthcare this way. And you'll really get to learn a lot about healthcare and what aspects of it you might want to consider in your future career, because it really is. It's nearly 20% of the economy, and there are so many different ways to be part of the healthcare ecosystem. And in the healthcare certificate, we have a couple of core courses and then lots of electives that will be tailored to the areas you would be interested in. Another interesting thing about healthcare is it's really not like any other business, in that very few people do really account for much of the spending in healthcare, and it varies a lot over time. In fact, one of the things we found through research is that even if you are in the top 1% of spenders one year because of various health issues, you tend to fall back down, fortunately, because you are not as sick the next year. But it makes it part of an economically complex and interesting field. So let's talk a little bit about what the healthcare certificate is about. First off, it's open to all MIT students. So what happens is it's not just Sloan students, but other MIT students will take courses with you, and you can take courses that are offered in other parts of MIT, and they will still count towards the certificate. What we also really do is it builds a community of students and faculty and industry partners, because we do projects, we give seminars, we introduce you to faculty when you're interested, even ones that aren't teaching, but they may be doing interesting research. Of course, earning the certificate, like all the other certificates, it demonstrates your focus, in this case, on healthcare through courses and projects. And I would encourage you, if you're interested in the healthcare certificate, and once you are a student at MIT Sloan, is to register for it. There's no obligation, but this will help us share information with you about courses and classes and remind you of what you should be registering for. It also puts you on our mailing list for invitations to seminars and other events that we hold throughout the year through HSI. So what do you have to do to earn the healthcare certificate? We have 2 required classes. Healthcare Lab, as I mentioned, I co-teach that one. It's a great course. It's also a fair bit of work, because it's both a class on healthcare operations with a major action learning project that you work with a team of your classmates on the project with a local company or a local hospital or healthcare organization over the fall and IAP, the January period, in your second year. So this is obviously not something you would be doing when you're doing your MBA core, but it's the second year you would take this class. And the other core course is Economics of Healthcare Industries, which is a spring class, and that one is half a semester in the spring. And then you'll be taking 24 units of electives, which in most cases is 2 or 3 classes, since most of our classes are 9 units or 12 units. And those are offered throughout your time at Sloan. Some are in the fall, some are in the spring, some are both. And I put a few examples here just to give you a sense of the variety. You could be focused on the strategic decision-making in life sciences. You could be focusing on entrepreneurship through healthcare ventures. You could be looking at healthcare finance issues. You could be doing other lab courses like operations lab, which will offer projects in many areas. But if you do a project in healthcare, that would also count towards a healthcare certificate. We also have courses, as I mentioned, in other departments. So in the health sciences and technology group, they have courses on, for example, machine learning for healthcare. In chemical engineering, which is course 10, they have courses like advances in biomanufacturing. That if those are areas you're interested in, you can take classes in that and learn more about healthcare that way, and also apply those to the healthcare certificate. So Healthcare Lab, what it is about is we do a lot of operations management work in healthcare. Healthcare is, especially healthcare delivery, there's a lot of operational issues around, for example, throughput of patients, scheduling, keeping track of who is where in hospitals, trying to improve capacity in hospitals and clinics and doctors' offices. So there's a lot of operations. We also bring in guest speakers, and we talk about IT and digital applications in healthcare, because healthcare really is a lot about the information that can be used to figure out diagnoses, to provide treatments, to keep track of your own health and population health. We talk about analytics, we look at incentives, we look at organizational design questions, we look at innovation, and we also bring in guests on current field research and practice. So we have a lot of senior executives that come in, for example, the CEO of Amwell, which is one of our, of course, Boston area local companies in telehealth. We have this chief medical officer of CVS Minute Clinic. We have the CEO of Medically Home, which actually got started in the Boston area. So, and lots of other guest speakers. We also offer lunches to speak to the guest speakers afterwards if you're taking the class. And then there is the action learning project. That is a really important part of your learning because you will be actually working with organizations on different projects. And this page lists some of this year's projects that students are doing even as I'm speaking. So for example, urology care access optimization at Boston Children's Hospital, where they've expanded their urology department, and now they have to figure out how to use that extra capacity effectively. At Boston Medical Center, there's a project around medical transport, which is often a real bottleneck when you're in hospitals trying to get patients from the OR to post-acute care, or to move, to move stuff around. We have an AI-related project at Dana-Farber this year. We have integration of a hospital at home program at Leahy, which, by the way, happens to be medically home, so everything comes around. Novartis, we're looking at clinical trials, and a startup named Synthera, we're looking at digital health. So there's a huge variety of projects that students can apply for, and we have a pre-selected list of projects, and students basically rank them, and we try to match students to projects that they really want to do. Now, in the economics course, it's much more health economics foundation. And as I mentioned earlier, health economics isn't really like standards economics. It is very interesting, very complex, lots of different incentives that matter to the different players. And here too, there are many guest speakers, many of them from the bio side of healthcare. as opposed to the operations side, which is in healthcare lab. But it also, between the two classes, you really get a sort of a managerial bird's eye view of the issues in healthcare. That would be interesting and important if you're doing an MBA. So let me tell you just a little bit about HSI. So we teach, as I was talking about, we do research with faculty across Sloan, and we work with practitioners, including many, many Sloan alumni. We run HSI seminars on many topics of interest to students. They're open to everybody. We've recently been doing a series on FHIR, FHIR, and digital health and innovation and what's now possible that wasn't possible 10 years ago in healthcare. And we do a lot of connecting across lunches, collaborating with the healthcare club, connecting students with faculty and projects and partners. I'm just showing you this list. There's a lot of faculty and researchers at MIT Sloan that do all kinds of healthcare related work in economics, in finance, behavioral science, operations and analytics group, and in work and organizations and systems. And many researchers also work across these areas. And lastly, just to get you excited about thinking about MIT, their Health Systems Initiative at Sloan isn't the only group doing healthcare at MIT. There are many others that you can get involved in. So I'd like to point out the Healthcare Club, which is online as well, has an annual bioinnovations conference that students run, and also is really the student hub for everything healthcare at Sloan. Other research centers at MIT, we have a Center for Biomedical Innovation, which focuses on global health and biomedical innovations. The Institute for Medical Engineering and Science is over in the engineering school and really looks at medicine and science and health, and also runs the Health Sciences and Technology program. We have the Jameel Clinic, which looks at AI in healthcare. And then we have JPAL North America, which is from the economics department and supports randomized controlled trials to really make healthcare delivery in the US more efficient, effective, and equitable. So you see that all the things that we do at HSI, there are other groups at MIT that have their focus on that area. HSI really is bringing together the Sloan research in health. And so you can find us online. You can look at the healthcare certificate. Everything I talked about the healthcare certificate is available on the HSI website, so you can look at it at your leisure, including all of the pre-approved electives. If you come to MIT, you'll discover all kinds of things, and if you discover another elective, you can petition to count that towards your certificate as well. And I'm always thrilled to learn more about different things that are happening at different parts of MIT, because no one can keep track of it all. The other part, and both of these, the healthcare certificate and then other student opportunities, are listed on the HSI website, which conveniently enough, if you type in hsi.mit.edu, you'll find it very easily. Thank you.
Perfect. Thanks,
Happy to
Anna.
answer questions.
Yes, this was great. I learned a lot as well. So awesome. Thank you. So some of the questions that we are getting to start, and you did touch upon this a bit, but can you give some more additional examples of what kinds of hands-on projects students have participated in the past?
So a lot of these are healthcare lab projects. We have worked with startups to help them develop a lot of market access, market research types of studies for different organizations, including one, for example, that was trying to bring in essence portable MRI machines to places other than hospitals, and they're still working on that. We have done projects looking at food as medicine and optimizing the kitchens in that area, and this was really an interesting project that was local, looking at the host asked the students, we want to do more, have higher capacity, make more meals. And when the students looked at the project, they discovered that actually one of the issues was that there were way too many types of meals. And if they just reduced the number of rarely ordered meals, they would increase their capacity. So sometimes you run into projects where the problem that, the host seems to think needs to be solved turns out to be a different problem. And we've always had a lot of projects with hospitals looking at operational improvements, scheduling, reducing no-shows, reducing wait times. And those are always fascinating because while there are, quote, standardized solutions from literature and, from theory, it always is really interesting how to figure out how to apply those in the specific situation that you find yourself in. So last year we had a project with a dermatology clinic, but other years we've had projects with outpatient care and with other specific, emergency room crowding and other specific situations that, there is a lot of variation and there's lots of specifics that you really get a chance to learn about beyond the classroom. You work with frontline, you interview frontline personnel, you work with hosts who provide you de-identified data about the specifics in that hospital or clinic, and you really can get your hands into what may be going on in an area that you knew little or nothing about.
Awesome. Yeah, that's really helpful. Those sound like really interesting projects.
Oh, they're great. Yeah.
Yeah. How much focus is put on non-US health systems? Are there any elective classes available on global health or developing country healthcare?
There are actually there are not so many full-length classes at Sloan. In healthcare lab, we usually devote a couple of sessions to global health because, especially when our faculty is researching that. So when Jonas Jonassen teaches it, a lot of his work has been happening in Africa, so we incorporate that. We actually learn a lot from our students who compare, their health system, and we often get students who are very familiar with it because, they're mid-career professionals, their health system in their country to the US system. It's also possible to cross-register for courses at the Kennedy School at Harvard or at other programs at Harvard that may have more focus on some of these areas. And as I said, the Kennedy School, the public health school at Harvard. So we do actually accept those courses as well.
Great. Are there any resources for healthcare entrepreneurship in the healthcare certificate?
So healthcare entrepreneurship, there are a lot of healthcare options and courses, there's general entrepreneurship courses. And if you take one of those and do your project in healthcare, that can count towards a healthcare certificate. There is actually our seminar series this year. We're coordinating with the Martin Trust Center, which is focused on innovation. And of course, Healthcare Ventures is another class that is focused on creating startups in healthcare, and that is also applicable to the healthcare certificate. So you really get some of the entrepreneurship courses are project-based courses, and if you do your project in healthcare, you can apply, through a little form. You can ask to have that course applied to the healthcare certificate.
Thank you. What topics does the Bioinnovations Conference focus on?
It varies every year. It really is student-led, and each year students are in charge and they bring in folks from different companies. So last year there was a lot of focus on AI. This year, other years we've had focus on, say, healthcare access, on underserved populations, on digital health. So each year is different, and it really depends on the students who organize it, which makes it a great activity and really a great networking opportunity for students to get. If you're getting involved in organizing it, that of course is a great opportunity for you to learn more about different areas and get to know companies that are in that area, and for that.
Awesome, thanks. So one of the next question which we've received a few times, how does the healthcare certificate help students in the internship and job recruiting process? And also, where do you see students end up post healthcare certificate?
We actually did that analysis this year, and about 2/3 of the people who earn the healthcare certificate do end up working in some aspect of healthcare, which can be through consulting, through the biomedical companies, the large pharma companies, or through startups. It's really kind of hard to tell because people do move around. We do know of multiple graduates who ended up working with some of our, healthcare lab host companies, and of course, people who then move around and stay in touch, in fact, with us, and become like healthcare lab hosts and things. So it really is. The healthcare certificate gets you really, it is a great marker on your resume, and it is really a way to get to know people in the healthcare ecosystem in the Boston area. And so many people do end up working in those fields in different companies or consulting.
Awesome. And kind of back to, if you're an international student, do you know what post MBA opportunities are available to international students who participated in the certificate?
They too, I mean, the thing with, many international students may go back to their home countries, but the healthcare certificate, again, having done that work, it turns out healthcare operations are not that different across countries. Students have actually told me that. That a hospital in almost any country has many of the same issues that it does in the US. The US system is just a little more complicated in terms of payers and the way insurance is set up. So if you understand the US system, actually most other countries have many of the same issues at different levels of scale. So many students do end up in healthcare companies in other countries. They end up in global consulting firms looking at healthcare issues. And I know of students that have started companies or started businesses in different aspects. Some I know at least a couple of students who have ended up doing NGO or government-based work in healthcare in other countries and around the world.
Great. All right, we'll take one more question, and the last one, and you did kind of touch upon it, and it's, what examples do you have for students participating in the healthcare certificate, how they've been able to collaborate with the other schools and departments at MIT?
So I've had a number of students in the healthcare certificate. I had one student a couple of years ago who was an MBA student who was working in one of the hospitals in the Boston area, who wanted to explore doing research around emergency department, decrowding, I suppose, reducing delays. And I put her in touch with one of our operations management faculty, and they've actually been collaborating now for several years on research at this now this graduates hospital in the Boston area. So that's one. Other students, can you repeat? I'm sorry, I'm losing the thread. What was the second half of the question?
Sure. It was just it was how students participating in the healthcare certificate are really able to integrate themselves outside of the actual Sloan community.
Mm-hmm. And so this is where linking to both the healthcare club, which is mostly but not exclusively Sloan students, or linking to some of the other research groups and students groups. There's also an MIT-wide biotech community that we can connect you to as well. So it really, I mean, the thing about Sloan and MIT is that it's just such a marvelous ecosystem that you can go explore. You really lots of web research, meeting people, connecting with people, showing up at events that you're interested in will really get you, you know, it's just going out there, you will find people that want to talk to you. It is truly amazing. It's one of the joys of being at MIT, frankly, and I've been at MIT for a long time. I actually am a graduate as well, so it really is an amazing community.